specializes in neuro-oncology at Ochsner MD Anderson Cancer Center in New Orleans, Louisiana. She works to provide personalized attention and the most advanced treatment options available to patients and actively participates in cutting-edge clinical trials, offering patients the opportunity to benefit from the latest therapies. She studied at Vanderbilt University, the Emory University School of Medicine, and as a resident and fellow of the University of Colorado School of Medicine. She also serves as a senior lecturer of neurology at the University of Queensland Medical School. Dr. Goldin is speaking on behalf of her clinical experience and not representing the opinions of Ochsner Health System.
So I will be talking about Optune Geo more from a kind of science perspective and timing perspective. Thank you so much, Tori, for all that direct patient information. I love hearing patients' experiences with Optune Geo, and I especially love the trick about working up a good sweat on the days of array changes. That's really helpful. See if I can get my slides to advance. Here we go. To start, most of you, I'm sure, know what glioblastoma is. To make sure we're all on the same page, glioblastoma or glioblastoma multiforme, shortened to GBM. It's a type of primary brain cancer. And what that means is that these tumors start in the brain. They don't start somewhere else and then spread to the brain. And 99% of the time, they stay within the brain and they don't spread elsewhere in the body. It's the most common type of primary brain cancer in adults. Glioblastoma, in terms of overall cancers, is fairly rare, but like I mentioned, in terms of brain cancers, is the most common. It is more rare than things like lung cancer or breast cancer, but there are about 12,500 new cases of glioblastoma in the United States each year. So if you are diagnosed with this, although it's a rare tumor, you're definitely not alone. When we're talking about the use of Optune Geo and other treatments for glioblastoma, we're often talking about different times of treatment. The first time of treatment is right after you're diagnosed with glioblastoma. Other times for treatment is if the glioblastoma unfortunately comes back and is growing again. To go over some vocabulary that we'll be using today, when a glioblastoma is first confirmed by your doctor, that's called a newly diagnosed glioblastoma. Even after 1 or 2 years, as long as your tumor hasn't come back, it's still called a newly diagnosed glioblastoma. That's compared to recurrent glioblastoma, which is when that tumor has come back after a period of time, and you can see that tumor growing on the MRI. The reason that glioblastoma returns is because even if you have the best surgery, the best upfront treatment, we know that there's always going to be some microscopic tumor cells that are left behind in the brain. And because glioblastoma can be pretty aggressive, those cells can sometimes wake up after that initial treatment. And it's difficult for all that treatment to reach every single glioblastoma cell. Let's get into talking about Optune Geo. Optune Geo is part of both treatment for newly diagnosed glioblastoma as well for recurrent glioblastoma. What's really nice about it is that it's what's called non-invasive, meaning that it doesn't involve things like a surgery. It doesn't even involve taking a pill. It doesn't involve an infusion. It's a portable treatment. Like Tori was mentioning, you can take it everywhere you go with you. The only thing you can't do is get it wet, so no scuba diving while you're wearing it. And what it does is it delivers what's called tumor treating fields directly to the glioblastoma tumor site through this portable device and the arrays that adhere to the skin. The way that it works is that it uses what's called alternating electrical fields. Those aren't something that you feel while you're wearing the device, but what it does is it disrupts a tumor cell's ability to divide. And when you stop the tumor cell's ability to divide, you prevent the cancer from growing as quickly. Since healthy cells are different than cancer cells, their division rate is different, their electrical properties are different, they're not affected by the Optune Geo. This is a nice slide that has a good visual aid for how Optune Geo works. So this is showing in the first box there, a tumor cell. The second box is showing you a tumor cell that's starting to divide. And the third box is showing you how when tumor cells are dividing, it leads to more and more tumor cells, which leads to tumor growth. What Optune Geo does is when it's turned on, again, it creates those wave-like electric fields called tumor treating fields. And those tumor treating fields don't allow that cell to divide the way that it wants to. And scientifically, when a cell is trying to divide and it's not able to, it goes under a process that's called apoptosis, which just means that the cell dies. Optune Geo is designed to fit into your everyday life. I love all the pictures that Tori shared of him wearing his, doing a lot of things. It's portable, so you can use it for your normal daily activities. You can wear them fairly discreetly, so you can wear a hat over the arrays or even a wig. There are 2 bag options that are provided for carrying the device. There's a sleeve bag that you can use in what they call a convertible 5-in-1 bag, where you can wear it a lot of different ways for on-the-go use. Based on the studies that were done on Optune Geo, it's recommended that it is turned on and delivering treatment for at least 18 hours a day, which if you take a 24-hour day, that's about 75% of the time. What we've seen in clinical studies is that patients who spend more time using Optune Geo have extended survival. Because of the clinical data of the 18 hours per day providing kind of the maximum benefit and going above 18 hours a day as well, that's where we get that kind of usage goal of 18 hours per day. Let's talk about the efficacy and clinical benefits of Optune Geo. For newly diagnosed glioblastoma, this was FDA approved in 2015 for use. When you use Optune Geo for newly diagnosed glioblastoma, it is an NCC in Category 1 preferred treatment, along with radiation and a chemotherapy called temozolomide. NCCN is a group that creates guidelines for cancer treatment nationally. And so the upfront treatment standard for newly diagnosed glioblastoma is a combination of radiation, chemotherapy, and Optune Geo. If you have a newly diagnosed glioblastoma, again, you would first have a surgery, radiation and chemotherapy together, and then you would start the Optune Geo along with the chemotherapy. For recurrent glioblastoma, again, which that means if the tumor is growing back on your MRI, Optune Geo has been studied alone once other treatment options like surgery and radiation have been exhausted. Another thing that's great about Optune Geo that I like to tell my patients about is that because it's not a chemotherapy and because it provides local treatment, there aren't the typical chemotherapy-related side effects. And so the device is used with chemotherapy, and so there are some reported side effects of things like, nausea, loss of appetite, fatigue. In my experience, it seems that those side effects are more related to the chemotherapy itself than the Optune use when those are being used together. Unlike other chemotherapies, it doesn't have a combination effect with the chemotherapy that's prescribed for glioblastoma, meaning that the use of Optune Geo along with chemotherapy does not worsen the side effects from chemotherapy. There was the large clinical study that I mentioned back in 2015 that led to Optune Geo being approved for first-line treatment for glioblastoma. It showed better survival rate for patients who used the Optune compared to patients who didn't. My favorite data from this study is this 5-year survival rate, because when I talk to my patients, yes, people care about being able to extend their survival by even a few months, but everyone wants to be that long-term survivor. They want to be the person that lives a long time, even with this diagnosis. And in the study, what they found was that patients who got the standard upfront treatment with radiation and chemotherapy alone had about a 5% survival at 5 years, meaning 5% of patients were alive 5 years after diagnosis. When Optune Geo was added to that, there was a 13% survival rate at 5 years, so more than doubled that rate. We mentioned a bit that Optune Geo does not have additional side effects along with the chemotherapy. It doesn't worsen chemotherapy side effects. The main side effect with Optune Geo use is scalp irritation and headache. Other side effects that are listed, such as malaise, falling, twitching, in my experience, I attribute those often more to the chemotherapy that's being used with the Optune Geo than the Optune Geo itself. The main side effect that I see in my patients, in my experience, is the skin irritation, which can include dermatitis, which is red, inflamed, swollen, flaky skin, what's called folliculitis, which is inflammation of a hair follicle that can look kind of like a pimple, and erosions, which is where you lose the outer layer of skin and you have a little bit of an indented sore. So how do you incorporate the Optune Geo into your daily life? We talked about trying to wear the Optune Geo for at least 75% of the time, and Optune Geo can be given almost anywhere. I have patients who wear Optune Geo at work. I have patients who travel with Optune Geo. I have patients who go to weddings, graduations while wearing it. The transducer arrays need to be applied directly to your scalp to work properly. And I know Tori went over his kind of shaving routine and how he preps his skin. In order to wear the Optune Geo, you do need to shave your head so that those arrays can be right up against your scalp. And then to prevent the transducer's arrays from getting wet, if you're not changing your arrays that day, you would cover them with a shower cap while bathing or showering. One thing that's great about Optune Geo is that the company Novocure has this My Novocure, which is both an app and a website and a phone number you can call. And My Novocure has been really helpful for both me and for my patients. From my side, when I prescribe Optune Geo, it goes to My Novocure and they help sort through any insurance support that's needed or any financial aid that might be needed for patients in the case of insurance not covering as much as we'd hoped. They also take the lead on reaching out to the patient on bringing the Optune Geo device to their house and showing the patient and their caregivers how to use it. They have a lot of tips for integrating Optune Geo into your life, resources for when you're traveling, as well as treatment information and troubleshooting. Like Tori mentioned, Optune Geo also has a buddy program, which is another part of the My Novocure that I love. I can tell you all day about Optune Geo and what it's like and what the data is behind it, but I've never worn it myself. And so I love that there's this opportunity for patients who are using or considering Optune to talk to someone else who's going through what they're going through and who's actually using the device. Novocure also has webinars for Optune Geo. It's another way to get more information about the Optune Geo and potentially meet other users that are wearing the Optune Geo. These are some QR codes and some websites that are available for you to learn more information. That is what I have.
Oh, awesome. Thank you, Dr. Goldin. Yay. Yes. Yay. Yay. We have some questions that have come in during this webinar, as well as a couple of questions people asked when they registered for our webinar.
Great.
So we have some people from Africa and India asking, is the Optune Geo device available outside of the United States?
That's a great question. I know that there are countries in Europe where it's available. I'm not sure about India. I'd have to ask the Novocure team.
For the countries you do know that it's available, are you able to say some of those countries or?
I believe it's available in places like Spain, France, and Switzerland. Outside of that, I'm not sure.
Okay. Okay.
I believe Germany and Japan. I know there are Novocure offices in Germany and Japan, as
Great.
well as Switzerland.
Excellent. But, there's people worldwide, it sounds like, looking to have availability to this device. And that's something, too, that we can share with the Novocure folks and then kind of maybe find out where they're at in that process of doing that. So keep us in mind for finding out more information related to other countries in the United States and where Novocure is at as far as having it available. Oh, this is a good question. Dr. Goldin, related to the Trident clinical trial, do we have any results yet?
I'd have to defer to the people who are running the trial on that.
Okay. Okay. And so Shreya, our patient navigator and clinical trial coordinator, can work with the PI on the Trident trial and find out the answer to that question. So we'll get back to you, okay? You covered this a little bit, but someone has written in, is there any data on the survival rate of Optune Geo alone?
Yeah, that's a great question. For newly diagnosed glioblastoma, there is not. And that's because we've had so many other clinical trials that show that surgery, radiation, and chemotherapy do so much better than nothing else. And so to build a trial where a patient is not offered a standard treatment like that, it becomes an ethical issue. In terms of recurrent glioblastoma, the way that Optune Geo was studied for recurrent glioblastoma was by itself. So they compared Optune Geo versus physician's best choice chemotherapy. And what they found was that the outcomes were about the same between the two.
Thank you very much. Tori, thank you for answering some people's questions that they're directing towards you as well. Thank you. This is an interesting question. What is the efficacy shown with TTFs and how are they affecting overall survival?
Yeah. So what the study shows that looks at newly diagnosed glioblastoma, which again is looking at people who got surgery, radiation, and chemotherapy alone versus all of that plus the Optune Geo, the data shows that the overall survival increased on average by about 5 months. The 5-year survival rate increased from 5% to 13%.
Thank you. Thank you. I have another question, and I'm not exactly sure how to ask it because it's from a patient from New Hampshire. And it says, Optune outcome studies, immunotherapy for glioblastoma. I'm wondering if they're asking if there are any Optune studies utilizing immunotherapy for GBM. I'm wondering.
There is a study that's going on that's looking at Optune with pembrolizumab, which is an immune therapy. That trial is still going on.
Do you know the name of that trial?
Oh, I don't remember the number of it off the top of my head. It's
Okay,
EF,
that's okay.
EF something.
That's okay. Shreya can find it out. Now, this is an interesting question. Why isn't Optune Geo the standard arm for most current clinical trials?
Yeah, that's a really great question and a point of contention with some people. What I've seen is that now that Optune Geo has that NCCN preferred treatment designation, that clinical trials are becoming a lot more open to having Optune as part of the standard treatment arm. I think it's a slow transition. What I've seen in my experience is going from either you can't use Optune during this clinical trial, we're not quite to you have to use Optune during the clinical trial. We're kind of in between where sponsors are saying you can use Optune if you want to, and you can still be in this clinical trial.
Thank you. Thank you. And a great question, of course, Optune Geo, is it covered by insurance?
Yes, it is.
Yes. There's been a lot of hard work, advocacy work behind that. And I can tell you it is covered by insurance, finally. Thank you, Dr. Goldin, so much for spending your afternoon with us and educating us. And
Thank you.
I appreciate your work with this patient community. Thank you so much.
Yeah, thank you for having me.
Absolutely. Thank you.